Good day. I know there's been much news about people delaying visits with their clinicians or delaying much needed surgeries out of fear of COVID-19. A couple of months ago, Project Patient Care developed a guide with patients on how to prepare for and set the expectations of healthcare providers. If you're going into a hospital or outpatient surgery or procedure, it's very helpful for you to look at this guide. Today I have with me Dr. George Bakris, who is going to share with you why you should not delay a visit or treatment. The majority of hospitals and surgery centers are well prepared to take care of you and protect you from COVID-19 while you are at their facility. And we know there are some concerns that if you're not getting the care that is needed now, it could evolve into something major. Dr. George Bakris, I understand that your research has turned into clinical and quality improvements, especially in the area of hypertension, diabetes, and chronic kidney disease. Additionally, you see patients, so you're both a practicing physician and a researcher with over 1,000 publications. Can you share with us your passion for both research and taking care of patients?
Well, Pat, thank you very much, and thank you for having me. I think it's important for patients to understand that their physician is not just a healer, but also a teacher, a confidant, and kind of a mentor of sorts, or they should be, as far as I'm concerned. So my interest has always been in diabetic kidney disease. I'm a kidney specialist, and blood pressure. And what I do is see patients, referred patients that have these problems, and the primary physicians can't seem to get them under control. Now, as part of that interaction, I basically ask the patient questions about their disease. And what I find out is they think they have a sugar problem, or they have a pressure problem, or they have a very simple. So I try to integrate it together. In order to do that, you need to understand what's going on. If you read, sure, you can get an understanding, but if you're doing the research firsthand, looking at specific things, it gives you a different perspective. And certain things you thought you understood, now it turns out you don't understand as well because you've learned other things. So it's a maturity kind of thing that you're passing on to the patient. So for me, this integration has worked well over the past 30, 35 years.
I also know that you've had a focus on disparities. Can you share what you have found and the needs that need to be addressed?
Well, we've known for years that there's been a disparity in kidney disease, especially in the Black community, and especially their preponderance to develop hypertension. So in the 1990s and kind of the early 1990s, a group of us got together and worked with the National Institutes of Health and put a proposal together to specifically look at Blacks and progression of kidney disease, and specifically in those with hypertension, not diabetes, not other diseases. That ultimately was called the African American Study of Kidney Diseases and went out 10 years. We've had numerous publications from it, and what we learned is the level of blood pressure needed to slow progression of kidney disease, the kinds of medications that we thought worked, and we solidified those and validated them, and things that interfere in lifestyle with getting the blood pressure controlled. So we had cooking classes, we had Q&A classes where patients could ask questions, and we really developed kind of a community across the country because there were 21 centers across the U.S. that really did this. And that remains today a seminal study that we refer to.
So, talking about the access to timely and safe care, not only for disparate populations, but for everyone, especially during these COVID-19 times, it's essential to many people. And I know you use telehealth services, and maybe can you tell us how that's working out for you and your patients?
Clearly, when we were confined to quarters, if you will, there needed to be a mechanism for patients who had problems and needed continual care to interact with their physician. And so Zoom was a very opportune mechanism to be used to allow this to happen. And there are other mechanisms as well. So many academic institutions adopted it immediately and set up a system where patients would get appointments. We would have links as physicians. We would tie into them. They would tie into us. And things worked out great. And they're still going on as we speak. And many patients who either have transportation problems, live far away, have issues, they love it. And, they're willing to come in once a year, but that's it. Now, unfortunately, not everybody has a computer. And while you can do this on cell phones, it's not quite as good. But there's other mechanisms. There's a mechanism called doximetry, where I call the patient accepts my invitation, and guess what? It's like FaceTime. So you see the patient, they see you, you can do your visit. Now, that's not good for everything, but I would say 90 to 95% of visits you can handle in that way, especially if the patient is helping you and giving you information that you've asked for in advance. And it's really a good way to communicate. It's not perfect. Obviously, you can't do an exam, but there are certain things that the patient's complaining. You can at least look because the camera can be directed in that direction. So I think it's important. One of the things that I've noted, you ultimately are going to have to leave to get laboratory tests done. You're going to have to go somewhere. While they do have groups that come to your house to draw blood, that's an extra expense, and it's not for everybody. So you do need to get out. And I think people, patients have told me they have not left their house since March, which I find extremely difficult to believe, but I believe them. And it's this fear factor that they're really concerned about. And it's a problem because some of them they've needed to go to emergency rooms. You can't handle things over a call. And they have reluctantly gone, but they needed some coaxing, which normally would never happen. So I think you need to use judgment. People talking about masks, that's not made up. That's not fake news. That's real. And it works if you use it appropriately. Washing your hands, keeping your distance, that all works. There's not any discussion about that. So as long as you're using common sense, as long as you're trying to maintain these factors to get yourself to a place where you can be evaluated, I think it's critical because you literally, inadvertently, can end up having something horrible happen to you simply because you were afraid. So be careful.
I do want to focus a little bit on you right now. And on a recent physician visit, you were diagnosed with a rare cancer. Can you share with us what that is and why it's important to seek care when people are not feeling well?
It's an excellent point. I'm happy to do that. I had a cold. This was earlier this year. And as I was getting over this cold, I was noticing I was having more trouble breathing. Usually you'd expect less trouble breathing. Didn't make sense to me. So I went and saw an ENT. He told me that my sinuses were fine, but it looked like there was something else going on in my throat. And I basically saw an ENT he did some CT scans and everything and basically found what's called an anaplastic thyroid cancer, which is basically, I think the easiest way to think about it is a renegade cancer. It starts off as something very benign and genetic modification occurs and it becomes this very aggressive. And this thing had moved up my neck and invaded my trachea. So it was actually in my airway. And that's why I couldn't breathe. It was blocking it. So long story short, saw an oncologist, had surgeries done and all of it. And then tomorrow, having kind of the final touches on everything. However, if I'd stayed at home, if I said, well, gee, but I'm scared, I'm not going out, I'd be dead now. There's no question. I'd be dead because I would basically have suffocated. So there's no question you're going to need to go out. There's no need to be afraid. If you're going out as if nothing was going on, well, yeah, then you should be afraid. But if you're following all the precautions, you should be fine.
You mentioned that tomorrow's a big day. You're going into the hospital and you're going to have some surgery. As a physician, you know the ins and outs of what goes on in a hospital or healthcare setting. So you're not concerned about going to a hospital. And you seem very comfortable in knowing that the hospital is prepared in the midst of a COVID-19 pandemic to take care of you. So how is it that the hospital has prepared to keep you safe?
When you come in, you have to sign in, they're checking your temperature, they ask you a bunch of questions, you have to sanitize your hands, and you haven't even gotten in the hospital yet, you're still kind of outside. And then if they think it's okay, they will let you in. You have to be wearing a mask, to distance yourself, all the things that we just talked about. And then basically what's happened is if you need surgery, they have set up specific surgical suites where airflow has been modified if you have COVID viruses, and that's been done on purpose to not mix people with COVID that don't have COVID. So there's a special kind of like in the old days when you had tuberculosis, you go to a special wing that has special equipment for COVID. So trust me, they have all the bases covered. There's special isolation. There's literally, they are better prepared now now than they were for any prior epidemic you can imagine, including cholera, TB, etc. So nothing to worry about.
So, one of the concerns patients oftentimes have is their post hospital care. And have your physicians prepared you for care at home?
Physicians definitely prepare you for care at home. Not only physicians, nurse practitioners, nursing assistants, and it depends on the type of care that you need. If you need truly assisted care, they will make arrangements and send out a nurse. And a lot of the stuff that you can do in-house. If you need to come in, hey, then you need to come in. They will arrange, if you can't, they will arrange transportation to bring you to the hospital, and they will take you back. So there's no reason that you can't get care unless you refuse.
I know that you're a physician that focuses both on treatment and prevention as well, but why is it important to follow through on that?
If you have a virtual visit, some people think, well, that's just a chit-chat session. They didn't have to go anywhere. All they got to do is get their computer open and click, and what are we going to talk about? There's really nothing there. That's not true, because the physician has very specific questions they want answered. Only you will have the answer. And if you miss the visit and think it's not important, especially if you have a valid reason, oh, okay, that's fine. But you need to let us know, or let a nurse know, somebody, so we can reschedule a visit. There's nothing wrong with that. Things come up all the time. I've had people that were due for a visit. They wouldn't answer their phones. We called them on their cell. They're driving a car. They forgot about the visit. It turns out, one of the things I learned, these virtual visits, people don't think of them the same way. If you got a doctor's visit, you're going to get out, you're going to get in your car, you're going to drive somewhere. You got a visit. This is like you've scheduled a television program, and oh, I'm sorry, I'm busy doing this, I forgot about it. And there are people that literally pulled over and did the visit in the car. I mean, that has happened. It's rare, but it's happened. So I think the easiest solution for that, for me, is put down on your calendar that you check first thing in the morning, and then you'll see, oh, there's a visit at this time. Okay, I got it. And then there's no problem. So you need some reminder somewhere.
Yeah, I think we're all working in this virtual world and trying to remember, that things that we used to do, like putting it on a calendar, making a reminder, it's the same thing.
That has not changed.
I know we talked about keeping the social distance, wearing a mask, and washing your hands. We're now coming up upon the season for the flu season. And why should people get a flu vaccine?
This is very important, especially for people over the age of 60, especially for people that have problems with diabetes, lung disease, heart disease, because they are particularly vulnerable or susceptible, I should say, to getting infected. And because these viruses take a toll on your immune system, and because your immune system is already compromised, because it's trying to fight off these other problems you got, it becomes more difficult, and you're much more likely to end up with more complications. Now, if you get the vaccine, does that mean that you're totally safe? You will not get infected? The answer is no. However, on average, you're at least 70 to 80% safer than if you didn't get it. Now, you can say those are not great odds. They're not great, but they're better than zero. So I think it's important, get the flu shot. And now with COVID, because my opinion, but based on all the data that I've seen, the real data, not the hype, we're not going to have sufficient vaccine. We'll have vaccines, but sufficient vaccine to inoculate the majority of people until probably the end of the first quarter next year. So we're talking about February, March. We're not talking about October or November. So, and I'm talking about how it would affect you, not, some elite group. So I think it's important to understand that if you're at least inoculated against the influenza virus, or the viruses that are coming around, that if you're not inoculated for COVID, okay, but you've got some layer of protection in addition to what you're already doing.
And again, I hope everyone takes your advice.
It's not those diseases that I mentioned, but also if you're African American, for whatever reason, you tend to have a worse prognosis if you get COVID. And this is being investigated, and who knows why. I mean, there's a lot of potential reasons, but nobody's nailed any. So the good news is we have solutions now if you get super sick, but we don't have solutions for prevention. And we know who's at risk, so they have to be careful.
Thank you so much. And In closing, is there anything else that you want to share with everyone?
I think what I would say is look at this as temporary, which it is, and change your attitude toward it, because you're not in prison, and it's not like somebody's out there with a gun that's going to shoot you if you go out. It's fundamentally the way you deal with it. I'm not suggesting that you go out and have a party, but what I am suggesting is for certain things that are absolutely necessary, a doctor's visit, to go to the drugstore, something, I don't know, but something that's absolutely necessary, prepare for it. Wear an appropriate mask, sanitize, distance. That's all you can do. Now, is that 100%? No, but it's at least 70, which is as good as a vaccine. So why not?
That sounds good. And thank you so much for taking the time today to be with us and to share with people that here you are, you're facing surgery and you're very confident of going into a surgical suite, into a hospital in the midst of a pandemic. And again, the comfort level is there, and it should provide hope for others and inspire them to get the care they need and not delay the treatments, because again, it could end up worse.
I'm going to leave the folks with a little aphorism that is kind of hokey, but it makes a point. I used to be enamored many years ago with words. If you took words and put them in a mirror, they would spell other words. And I just thought it was strange that if you take the word fear and put it up to a mirror, it spells the word reef. Now, misspelled, but nevertheless, that's how it's pronounced. So we all know what happens to boats when they go on reefs. So don't let fear guide you. That's the key.
Best wishes for tomorrow. I know we'll be all thinking and praying for you, and very confident that everything will turn out for the best. And again, thank you so much for not only this webinar, but for everything you have done in terms of making an impact in treatment and research in diabetes, hypertension, and chronic kidney disease. Again, you've been a jewel, a great jewel to the world. So thank you.
Well, Pat, thank you very much. I very much appreciate it.